I'm going to talk to you about the patient experience. This is based on 2 lots of research. The first bit of research, no association at all with my surname Janssen. I am not an employee of Janssen Pharmaceuticals. This was a piece of research done this year with our help, with the help of the CLLSupports Association. They have a program for becoming more patient-centric, which we are helping them with. And in particular, Mark over there, who will be talking to you later, our chair, is helping them with that program, as is another of our trustees, Steffi, who's not here today. And we were the ones who were able to recruit the patients for this survey. The pharmaceutical company recruited the healthcare professionals. And we call them HCPs for short. You'll get an awful lot of abbreviations. You have to get used to them. Their research for Janssen Pharmaceuticals was in Manchester and in London. And it had focus groups, 3 separate groups, the patients with 1 or 2 of partners, and separately nurses, and separately consultants. Others could actually observe them unseen. They knew they were being observed, but unseen. So I actually observed all the London ones. The patients didn't observe the consultants or the nurses, but the consultants and the nurses did observe the patients, so they could learn from the patients. And they also had other stimuli like picture stimuli to get people's gut responses to pictures. And they also had one-to-one consultations in people's homes, so it was an in-depth bit of research. We at CLLSupports have been doing a lot of research into our patients' and members' experience. And I've listed up 3 electronic surveys, which are quite big surveys with 300 plus participants. Besides our electronic surveys, the 3 that I just showed you on the screen, we always, like at this conference, we'll be doing it again. We have surveys which we do via discussion groups. Later this morning, you'll do one. And there are a few examples of the things that we've done and the numbers of participants. And you'll see in all cases, our participation is higher than the Janssen research. But it's not so much in depth as the Janssen research was. We write up all the findings of our surveys and we publish them on our website, so you can see them there. So how reliable are these research findings? Well, all of the patients who participated were members of our association, and you might look around the room and say, well, how representative are we of CLL patients across the country? We have 3,000 members. That is 1 in 10 of CLL patients in the UK. There are 30,000 patients in the UK. We don't profile our members, so we don't know their socio-economic background, and you may say it's a bit skewed. We don't know. But we are at least national. The healthcare professionals, as you can see from the second bullet, they are a reasonable sample in terms of experience. They had to have at least 8 patients they would see a month with CLL. They had to have at least 2 minimum years of experience, 30 maximum years of experience. As I've mentioned before, it was a small sample from Janssen, but in depth. We used pro bono, as we always do. We find pro bono people who are professionals in their field to give us their advice, and we use that for our market research. We use a consultant. Even to a secret, my husband. As I've said, Janssen had a professional company for market research, so it was a professional job in both cases. And the other thing which is extremely reassuring for us is, I don't know whether you noticed, the Janssen research was this year, and all the other research I've shown you was the previous years. It confirmed what we already knew. So there was nothing contradictory in what they said, and that was very reassuring for us. What was very good for us with the Janssen survey was that they were involving healthcare professionals as well, which, because we don't have a vast pocket like pharmaceutical companies, another secret, they paid the consultants £260 and the nurses £250. They pay the patients £50. So that's how much they value our time. By the way, I never introduced you to Helen Knight here, who is a nurse at Nottingham. So I don't know whether, do we have any other nurse specialists here? No, but Helen has come for this morning. So if you want to speak to Helen, nurse specialist, she's here. So yes, I would say that they were fairly reliable, these findings. And you have to remember that all market research is about trends. It's not a precise science. So I'm going to take you now through the journey of the patient. So first of all, the diagnosis is a very critical time. How it's handled is absolutely key to the patient experience and them having a positive experience. Finding of the Janssen research was that more healthcare professional time should be given to the patient at the time of diagnosis to ensure that they really understand what CLL is. Access to a specialist nurse is ideal, but it's not always possible. There's then the psychological aspect that is very marked at the time of diagnosis and not always met. In fact, rarely met. And then, as already explained by Lewis, this term chronic is very poorly understood by patients. It's not immediately life-threatening. It's slow to progress. Those are the things that people need to take on board. And then again, mentioned again by Lewis, this watch and wait, watch and worry, or nowadays active monitoring. It's trying to get away from this message, so I've got a cancer and you're not doing anything about it, how can that be? To something much more positive in your attitude. So it's good, I don't need any treatment, and I may never need any treatment. 1/3 of CLL patients never need treatment, and it's good to be reminded of that. Then the newly diagnosed particularly find peer-to-peer support very valuable for relieving their anxiety, for feeling that they're not alone in coping. And that is where the charities play a vital role. And then other two things for the healthcare professionals to take on board: importance right at diagnosis of understanding what the care pathway may be in future. And also another thing taking on board is, what do the various healthcare professionals do? What's their job? And if the patients know those two things, the pathway and the team, what's sometimes called the multidisciplinary team, what their jobs are and what they do, then they feel much more confident and it reduces their panic. So we go on to treatment. As you'll hear this afternoon from Chris Fox, our consultant who's coming to speak to you after, he has a clinic this morning, he couldn't come this morning. There are many new treatments, and those Val spoke to us what a completely transformed situation it is from when she was diagnosed. But the outcomes vary. So do take an opportunity to ask Chris Fox if you have questions about those varied outcomes. Sometimes overlooked possible side effects. Again, the Janssen research revealed this. They want comprehensive details, and they want the patients to know what possible side effects are. Now this third bullet I was quite taken aback by, because it's not my experience personally, and I wondered how true it was of others. I'll read it out because I find it striking. Hematologists believe patients claim they want involvement in decisions. However, in reality, they want the hematologist to make the decision on treatment. Now, how many of you would agree that you would want your hematologist to make the decision on your treatment? Yeah, I mean, I count that. That's fine. I have no problem with that. But and I would remember, actually, I was watching them in the London focus group, and they said, one of them in particular said, "Oh, you just get a feeling how much information the patient wants." And I was sitting there behind the screen thinking, "No, ask them." So I didn't know, and it may be true that many patients who don't come to our conferences, they do want the hematologist to make the decision. Maybe it's the people who want to be well informed, who want to be in control, who come to our conferences, who therefore took part in our survey. So that's an aside, something to be debated. Stories from patients on treatment choices and experience are very highly valued. That's why we give them so much attention at all our conferences, and you just heard 3 examples. And that's something that we can do as a charity, which healthcare professionals don't do, and we can do. So now going on to ongoing management. There are really 3 sort of, as I can put it, packages. You can go to a tertiary specialist centre, and if you go to a tertiary specialist centre, you are more likely to get a what's known as a CNS or a clinical nurse specialist, somebody who specialises maybe particularly in CLL, if you're lucky. They may very well have CLL-specific clinics. They will probably have in excess of 200 patients with CLL. So you're getting the expert, but you may not get the continuity. You may see a different consultant every time, and a registrar. If you go to a district general hospital, DGH as they call them, you will get to know your local team and have continuity, which can be quite reassuring. Third option, which is the second bullet down, is you have a shared. So you go for your routine care to your local hospital, but when it comes to treatment, you go to your tertiary centre. For that to work well, you need good communication between the two, and it's not always as good as you would like. So you as the patient have to play a key role in keeping them up to date, both sides. So the best practice that Janssen came up from that research was understanding the HCP various roles. Something particularly with older patients, and remember that most of us are over 70, particularly older patients, used to the old school of thinking. They need reassurance, they need reminding that they can contact the nurse specialist if there is one, or the hematologist, and how to do it, and what they should do it for. And another aspect which is sometimes overlooked, holistic management. Openly ask a patient how they feel. That will give you a much more rounded picture of what the patient's going through. Tends to be overlooked by hematologists, not so much by nurses. Findings 4, I'm now looking at relapse. How many people have experienced relapse here? Yeah, just a few, 5 of you, 6 of you. Yeah, Janssen wanted to do their entire research on relapse, but we couldn't find enough patients for them. So the majority of the 18 were on relapse, and 2 or 3 weren't. So relapse, very difficult. You may not be feeling particularly unwell, maybe asymptomatic, so it's all the more frightening, all the more of a shock when it happens. Another finding of Janssen was that it's a weak area of support for patients when they get to a point of relapse. Treatment's good, particularly if you're on a clinical trial, you get a lot of support. Weak area diagnosis, weak area relapse. But positive, as we've heard again and again this morning from our 3 stories, CLL is now much better understood, and there are many more treatment options. Chris Fox will tell you more. Quality of life, holistic care is another area that hematologists don't focus on, and the patient needs to alert them to that if it's important to them. Clinical trials we've mentioned could be preferable because you get closer monitoring and you get expert management. Basically, you've got two types of treatment. One is a fixed course of treatment, which gives you a break, or you've got continuous treatment, and some hematologists go for that because CLL is chronic and not curable, so the treatment, they say, should be ongoing similarly. Psychological impact of living with CLL. This was a bit of research we did electronically as the Support Association last year, and you can see that the key point there is that 2/3 of patients have an emotional response to living with CLL. And there are various ways in which that manifests itself. Only 18%, that bottom bullet, don't experience any of those listed indications of psychological impact. The quality of your experience will depend very much on the relationship that you're able to build up. That was touched on very meaningfully, I thought, by Jill in her description of the very good support she'd had from consultant Ben Kennedy, but Lewis also mentioned it. Our research with GPs, we did a big research in Leeds at our conference, showed that patients tend to avoid the GP, understandably. They're generalists. I asked my GP, and my practice has 8,000 patients, how many have CLL? 12. So that, if my maths is correct, is 0.125, I think, or, well, 0.15. Very, very low. Why should they know a lot about CLL if it's that few who have it? But older patients, those who have comorbidities, will tend to refer to their GP. That's their natural source because they've got several conditions to manage. On the whole, if you're going to your GP, you have to educate your GP, and we've had lots of stories of how people educate their GP, and very often GP is delighted to be educated, so don't hold back. The specialist nurse, CNS, sometimes referred to or given the role of key worker, the key person of contact. They're very thin on the ground, CNSs. There's a national shortage. They're greatly valued by patients. Leukemia Care did a fantastic survey. Leukemia Care in the corner over there, if you want to hear about their survey, I will tell you about the CNS role for leukemia patients. So that makes a huge difference, the experience of having a CNS. So we've already mentioned the first point about the emotional support, but some hematologists are incredibly understanding, and they will take on the role, if that's what's sought, this holistic care and emotional support, if the patient alerts them to it. That was a Janssen research. The bottom bit about the patient role is our research. The patient role, as explained also by Lewis, is often assisted by the partner. Set the agenda. Clearly Lewis is a great one for setting the agenda. I am too. And often healthcare professionals welcome it. I have had consultants say to me, I wish all my patients did this. So what you're doing is in essence saying, look, this is the treatment I've had, these are my tests, these are the results, and these are my questions. How does that help the healthcare professional? A, they know how much you know. B, they know what matters to you. It's an enormous help to them. It sets up that partnership working, which is so vital to having a good experience. The patient's partner, we did a lot of work on this at our London conference where we had 72 participants, and these are just some examples from that survey. So things that the partner finds difficult, and interestingly, managing the partner's mood, the patient's mood was one of them. Other things, and the other 4 bullets, probably they're both experiencing. Then we asked our members at that conference, how would you advise partners to best support you? And there's a list of what they suggested. Just some examples, it was more than that. So I think, giving the patient time to rest and cope with their mood or fatigue. I found that second one quite perceptive. This disease, it magnifies the dynamics of your relationship. So if you have a close, supportive relationship, the CLL experience will enhance your closeness. If you're going through troubled and difficult times, it will make it even worse. And working in partnership, which Lewis described so well, that the 3rd and 4th bullets are very important for having a positive experience. And very much the patient looks to the partner to lift their spirits and have a positive outlook. Information to meet my needs, that is absolutely critical, we find, in all the consultations we do with our members. So what they tell us that they particularly appreciate in the information we provide is our website, very informative. We're revamping it. It'll be much, much better. Watch this space. It's going to be good. The Health Unlocked Forum, if you're not familiar with that, that actually now has 13,000 members worldwide. It's phenomenally successful as a support network. Buddy schemes, Leukemia Care, and together with our association have inaugurated a buddy scheme which is piloted this year, going forward next year. Healthcare professionals, and this is very telling, and this was a result of the Janssen survey that we discovered this, but we also know this from our own experience. They will recommend Macmillan and Cancer Research UK, great charities, but they cover all cancers, of which there are hundreds. And then specifically Leukemia Care and Bloodwise, yes, all leukemias, all blood cancers. But they don't know, on the whole, about CLL support as an association. They don't know, on the whole, about Health Unlocked. And there are the figures from our research. And we had 286 patients responding to this electronic survey. 8% of CLL support members hear about our association from a consultant, 4% from a nurse. They may hear from both, so they were allowed to tick more than one box. 65% from doing an internet search. So we've clearly got a job to get our message across to healthcare professionals. We tend to have our patients self-taught by doing their own research, as it pros and cons. And healthcare professionals, this was picked up from the Janssen research, they tend to use hospital and pharma information to give to patients on treatment. They won't give our information. Nothing wrong with that. But what we really would like is for them to tell us, patients, about the sort of support, that peer-to-peer support, that sort of emotional support, holistic support that we can provide. And this is the last slide, and this is going to be the foundation of your discussion in a minute. We are about to, our next board meeting will be in October, when we will be discussing our strategic plan and what our plans are going forward as a business plan for the next year. And we would like your help to see what we should be prioritizing. As I've already explained, we are a very small organization with limited resources. We can't do all of it. So should we be raising awareness of CL support amongst consultants and nurses? Remember that 9 out of 10 patients don't know about us. And we think that they could benefit from the sort of support that we can offer, which clinics don't have time for, and it's not their job to supply. We can do it. We would like them to know that. Should we increase the opportunities for peer-to-peer patient and partner support, more local groups, more buddy schemes, improve the helpline, those sorts of things, because our helpline is done largely on her own, I may say, by Gail sitting over there. She can tell you more about our helpline. But that is peer-to-peer support, and that's what's special about it, because Gail, being a partner, knows what it's like. Should we concentrate, as we have up to now, on accurate, accessible, up-to-date information? We are revamping our website. We are reissuing our information booklet this autumn. Should that be where we focus? It's a lot of work to keep it up to date. Should we, as you've seen, healthcare professionals appear not to know about needs at the time of diagnosis, needs at the time of relapse? Should we be educating them to raise their awareness, work with them to improve that? Or, because we're so small, should we focus on working with other charities? We do work with Blood Cancer Alliance, we do work with the all-party parliamentary group for blood cancers, so that we have more political clout. Should we be working more in that way because we're so small? Or should we campaign, as you've seen, 2/3 of patients suffer from the lack of psychological support? Should we be campaigning for improving that? 7 things, but there may be something else.